What is Munchausen syndrome by Joanne Bonney, Lana Freeman, and Gary Lord. It is not known exactly how common Munchausen syndrome is. Some experts believe that Munchausen syndrome is underdiagnosed because many people with the condition may succeed in deceiving medical staff. But it is also possible that cases of Munchausen syndrome are overdiagnosed because the same person could travel from hospital to hospital. A fairly large study that was carried out in a Canadian hospital estimated that out of 1,300 patients, 10 were faking the symptoms of illness. There appears to be two distinct groups of people who are affected by Munchausen syndrome. Women who are 20 to 40 years of age who often have a background in healthcare, such as working as a nurse or a medical technician. Unmarried white men who were 30 to 50 years of age. It is unclear why this is the case. Munchausen syndrome is a mental illness in which a person exaggerates or makes up an illness or injury. Munchausen syndrome belongs to a group of mental illnesses called fictitious disorders in which patients compulsively simulate a physical or mental illness. This condition can be treated. A related condition is known as Munchausen syndrome by proxy. This almost always involves a parent abusing her child by seeking unneeded medical attention for the child. A similar condition to Munchausen syndrome is called malnouring. Health experts have been able to distinguish Munchausen syndrome from cases of malnouring, in which often occur in a work environment. Those who suffer from Munchausen syndrome are most often seeking comfort and solace for their imagined sickness, while malnourers most often want tangible rewards at work, such as sick pay or workman's compensation. There are two basic types of Munchausen syndrome. Both involve, at their cores, a person's need to draw and expand the attention they receive from medical professionals. In some instances, people diagnosable with Munchausen pretend illnesses, while in others they actually make themselves or a child ill so as to garner that desired attention. When a person draws this attention to themselves, it is simply called Munchausen syndrome. In those horrific situations where a person deliberately makes a child ill so as to acquire and sustain the desired medical attention for themselves, it is this type we all know to the media as Munchausen syndrome by proxy. In 1951, British physician Richard Asher introduced the term Munchausen syndrome to describe patients that falsified their medical history and fabricated stories about their medical condition. He named the syndrome after Baron Karl Friedrich von Munchausen. Munchausen was from Germany, and he served as a soldier with the Russian army. He became famous for his elaborate fairy tales of his travels, and he fabricated stories about his adventures as a soldier and a hunter. This title is fitting because Munchausen syndrome patients are often deceitful. They fabricate stories about their own medical history and condition. This deception is done in an attempt to gain attention and sympathy from medical community and others. This often leads to repeated falsification that would possibly pilot unnecessary procedures and probable hospitalization. In 1977, British physician Roy Meadow coined the term Munchausen syndrome by proxy to describe patients who caused harm to their children and lied about medical problems in order to gain unnecessary services and to gain sympathy and attention. At times, extensive and needless procedures are performed on a child. This may lead to permanent damage or even death. Unlike delusional disorders and certain psychotic conditions where a person is misperceiving reality, the phenomenon of Munchausen syndrome is characterized as one in which the distortions and misrepresentations are quite conscious and deliberate. This is a great example of the clinical reality that consciousness and deliberation do not necessarily suggest mental health. On the contrary, as is the case with certain conduct disorders, the lies are often pre-planned and deliberately told so as to achieve a desired outcome without regard to the welfare of others. It is a psychiatric condition with serious and sometimes life-threatening dangers associated with it. A person pretending serious physical illness may wind up fooling the medical professionals and receive treatment that is actually harmful to a person without the feigned condition. Even more compelling, babies and young children who are deliberately made ill so the parent can bask in the medical attention using the child as their proxy can and do die as a direct result of being made seriously ill by a seriously mentally ill parent. People affected with Munchausen syndrome cross all socioeconomic, racial, and ethnic lines and can be seen by family, friends, and coworkers as being entirely normal people who became quite ill or whose child became very sick. Sadly, they often become skillful masters of deceit, who, while endangering themselves and/or their child, also drain urgent medical care and time away from those who may need it most genuinely and urgently. Causes and risk factors. The cause of Munchausen syndrome are not well understood. Because of the almost categorical unwillingness of persons with this disorder to acknowledge or accept treatment for it, research is sparse and, as of now, without meaningful results. Most clinicians agree that it is, however, a type of personality disorder. The following factors increase your chance of developing Munchausen syndrome. If you or someone you know has any of these risk factors, tell a doctor. Age, young adults, men are affected twice often as women, history of abuse or neglect as a child, history of frequent illnesses requiring hospitalization, personality disorders such as borderline personality disorder or antisocial personal disorder. Treating Munchausen syndrome can be very difficult. It always begins by the medical addressing any actual illness or injury the person may have deliberately brought on themselves or their child. No matter what the cause, serious illnesses is always to be taken seriously and requires intervention. Beyond that, the effective treatment can be quite elusive, as one of the hallmarks of the disorder is unwillingness of the person with Munchausen to admit that they have what they have deliberately done. While other conditions like clinical depression, bipolar, and borderline personality disorders exist at the same time, they can sometimes be treated with various psychotropic medications. These medicines intervention may impact the Munchausen syndrome, but may not. Because providing reliably effective treatment for this disorder is sometimes impossible and always difficult, especially in the Munchausen by proxy situations. Once the child is medically treated, The parent who made them ill is usually charged legally and may well be incarcerated in either a prison or a secure mental institution, with the disorder itself going untreated, but with other children then protected. In any healing activity, sound diagnosis is of the essence. Without it, appropriate and effective treatment cannot be strategically provided. Munchausen syndrome, either in its direct form or by proxy, is challenging and often difficult for medical professionals to identify. Unfortunately, the attendant behavior which endangers life may continue for some period of time before the condition is identified. No matter how skilled and able the healthcare provider may be, it is sometimes difficult to believe that a person could be just pretending in such a way as to endanger themselves or their child, and that they are doing it just for the attention. The longer it takes to identify the disorder, the more dire and potentially lethal the potential consequences of it become. The future and the best defense. In all likelihood, Munchausen syndrome will always be with us. It is not a condition that is apt to be eradicated, nor is any medicine available to treat the disorder itself. Horrific stories about it will continue to surface from time to time and for a while. While the terrible story about a child's death is on the front pages, our culture becomes acutely aware, for a while, of this profoundly disturbing condition. Then, many medical professionals may forget and let their diagnostic guard down. The best defense against the possible harm caused by people with Munchausen syndrome is, then, good medical training, which includes attention to psychiatric conditions which impact the work of nurses, internists, pediatricians, and other medical specialists. Here are some resources on Munchausen syndrome. Here are some cases of Munchausen syndrome by proxy. An 8-month-old boy was taken to an ear, nose, and throat doctor by his mother and grandmother. They complained of a sticky and sometimes bloody discharge that was coming from the child's left ear. After several doctors examined the patient, they determined that his ears were basically normal. 3 days later, the mother brought in videotape evidence to support his history with the discharge. The video showed dark blood settled in the ear and smeared across the face. At the examination, the patient showed no evidence of damage, just a little mucus. They decided to admit him into the hospital and do an examination under anesthesia. He had a little blood in his ear canal, but no trauma to his inner ear. At the follow-up exam, an initially dry ear was filled with mucus after returning from the audiology department. The area of the mucus was suspicious, and a nurse began to notice that the mucus would only appear after mother and child were alone together. It was later determined that the mucus was probably maternal saliva. The mother initially denied accusations, and the grandmother took responsibility. During the case investigation, it was revealed that both mother and grandmother had a history of abuse. Eventually, the mother admitted guilt, accepted responsibility, and the child was turned over to foster care.